Hamilton County is among the growing number of counties saying they're not getting the COVID vaccine fast enough from the state. Health Commissioner Greg Hesterman says vaccines are going to first responders and vulnerable residents in group living situations as directed by the state of Ohio. But he says the county's only getting about 500 doses a day. There are 800,000 people in Hamilton County. Dr. Richard Lofgren of UC Health says the rollout is not consistent.
The notification about when and how much vaccine we'll get is really pretty short notice. So, the idea that we might have the ability and product to vaccinate 300 people one day and 1,000 people the next day makes it difficult to get the scheduling pieces of that.
The health commissioner says eventually there may be drive-through vaccination clinics in some parts of the county and gymnasium clinics in others. UC Health is starting the second dose of vaccine this week.
Meantime, private care physicians say they're being left out. Local 12's Catherine Robinson has a message from a local pediatrician. Morning, Catherine.
Hey, good morning, John. Left out of the vaccine rollout and left without information. Nicole Baldwin is a doctor with Northeast Cincinnati Pediatric Associates. She's vocal on social media, sharing information about child health, general wellness, and currently about COVID-19. Dr. Baldwin posted this video on TikTok and Twitter expressing her frustrations with trying to get the COVID-19 vaccine. She says private care physicians, while prioritizing Ohio's first phase of distribution, aren't getting vaccinated as quickly as they should. She says her practice filled out the surveys required from the health department when the vaccines first rolled out, but they've heard very little since. So little that she's been contacting several health departments, pharmacies, just trying to get some answers. Dr. Baldwin believes that this is a multifaceted problem. She says one challenge is the State Department, leaving it to local health departments to prioritize areas of distribution. And in Hamilton County, she says primary care is at the bottom of that list.
Not to say that EMS and group homes aren't super important to vaccinate. They absolutely are. But as physicians who are, especially pediatricians, seeing patients who can't always wear masks, who are oftentimes asymptomatic spreaders, who are bringing parents and siblings in with them, our risk is high. And because we're not affiliated with a hospital, we feel like we're just being left out.
We took Dr. Baldwin's concerns to the Hamilton County Health Department, their response and a possible solution coming up at 7:45. John?
All right, Catherine.